Hi there, you're welcome to DemiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can help support our community here on DemiRx Care, as well as also get alerts anytime we post our other educating videos and contents on our YouTube channel. All right, so let's go ahead and talk about our topic for today. So our topic for today is Entresto. So Entresto is also known as Sacubitril-Valsartan, which is a 2-drug combination medication that's used in our patients to treat heart failure as well as hypertension. So this medication comes in 3 different doses, which is the 24/26 milligram. It comes in a 49/51 milligram as well as a 97/103 milligram tablet. So this medication is usually used twice a day, and patients will usually start with the 24/26 milligram tablet twice a day, and they may be increased every 2 to 4 weeks depending on how well the patient is tolerating the medication or how well the medication is helping in terms of their condition. So what are some side effects to look out for with Entresto? So side effects of Entresto include low blood pressure. So we're treating patients who have hypertension, and this can be a good side effect because it's going to lower the blood pressure. But what we don't want is an abnormal level or value of blood pressure, which is a way lower amount than it's supposed to lower it for. So another common side effect is abnormal heart rate. So make sure that you're looking out for that. Make sure that you're checking your blood pressure to make sure that it's not too low or too high, and the medication is actually working as it's supposed to. Another common side effect is dizziness as well as cough. So this cough usually comes in terms of a dry cough, and you can check out one of our videos regarding how to treat a dry cough. So what are some serious side effects that we want to know when treating a patient with Entresto, and we want to reach out to the physician immediately so that way they can substitute the medication or monitor the patient closely if this therapy is absolutely required? So this serious side effect include angioedema. So angioedema is a form of an allergic reaction to the medication, which can cause swelling in the facial area, in the tongue or the lip area. And usually when this happens, this medication is usually stopped immediately. And it's noted on the patient's profile that way such medication or something in that class of that medication is not prescribed for that patient during their lifetime. So another serious side effect is kidney failure. Usually this medication is taken in patients with kidney disease, but you also have to make sure that you're monitoring those patients. This medication can also cause swelling in the leg, so make sure that you're reaching out to your doctor if this becomes, bothersome. It can cause low potassium in some patients, and low potassium can cause side effects, especially in the heart. Also, this medication can cause decreased urination as well as cloudy urine or dizziness and fainting. And if this becomes consistent, make sure, like I said, you're reaching out to your physician. That way they can stop that medication and prescribe something else as a substitute for that medication. So what are some other pointers that you want to know about this medication? So this medication may be given with or without food. Also, this medication should be avoided in pregnancy, as this medication can harm the unborn baby. Most especially during the 2nd and the 3rd trimester, this is not a medication that you want to use in that patient population. So this medication dose should not be doubled. If it's closer to the time of your next dose, just make sure you skip that dose. A regular or a general note is you don't want to miss your medication, but there's sometimes we're all humans and you forget to take 1 or 2 doses here and there, but you don't want to double that dose just because you missed a dose and increase that side effect that's not supposed to occur at the beginning you're taking it the regular dose. So this medication also, you don't want to take it with a class of medication called the ACE inhibitor. The ACE inhibitor are usually medication that ends in pril, such as lisinopril, ramipril, benazepril. So those medications you don't want to take with Entresto at the same time. Usually if patients are switching from this medication over to Entresto, they need to have a 36-hour washout period before they start Entresto. So if you take lisinopril today, you probably won't start Entresto until 36 hours after you have taken the lisinopril. These are stuff to look out for when you're taking the medication. If you have any concerns, you can leave your comments down below, and we'll try as much as possible to answer your medication related question, or you can reach out to a pharmacist on our website, which is www.damirxcare.com, and they'll be able to better assist you and consult with you regarding this medication as well as other conditions that you may have. Thank you for watching. If you have not yet done so, make sure you hit the like and subscribe button again. That way you're able to get alerts anytime we post any videos relating to this medication or other medication that you might find interesting. All right, thank you and stay tuned.